right. Oh, well, that was easy.
Where everybody's clips are gone. Wait, can you see this? Do you see participants in chat box?
Oh, wait.
We won't ever see that.
Okay. And then how, like my little people left.
So upper right-hand corner of that participant chat should allow you to change your view. Just to the left of participant, there should be speaker view, and there should also be gallery view. Can you do that?
There's nothing.
Look, I'm going to show you my camera right here real quick. So I've got.
No, I can't see you.
Monitors too. So right next to participants, I don't know if you've got this if you hover, but there could be a speaker view, and there can also be a gallery view. You can also look behind other windows, Charlotte. You may have a second screen behind something, but it shouldn't.
Mine does. YouTube feed shows it's still thinking, but it's showing live. Let's see. It's saying it's live. I'm checking on the page.
Okay.
Because right now it's working. Good. Okay.
Good.
All right.
It just timed
Okay.
out.
You see how I have okay. Like, where are my little people?
They should be on your second monitor right beside your participant.
Oh, okay. Wait.
All right. I'm making Charlotte, I'm changing you to host. If you can make me co-host, I'm going to hide.
Okay, there we go. And then, oh, but see when I change the screen, I lose my people.
Do you have two monitors?
Maybe because you're going duplicate. Let's go back to where you were. Go back to your from beginning, and then let's see what the options are. Hold on.
All right, hold on.
Hold on. Wait for that to come up. Now it's not coming up.
Yeah, I don't like that display version. You can actually close one of them, I believe.
What do you see now?
All right, I see your slide properly displayed.
Okay. Then I'm gonna just leave it.
Can you see your little people now?
Yes. Now let's see. Did it switch?
Yes, it switched to the next slide. Yes.
All right, cool. All right, I'm gonna do it like this.
Okay, and if you want to make Betsy a co-host real quick.
And do we need to spotlight anything online now? So YouTube's showing as, the agenda or the opening slide and whoever's talking. Right? We don't need to worry about
Right. If you
that's
ASL or anything.
Yeah. If you allow it to voice switch, it will just switch to whomever is speaking.
Right. Okay. All right.
And then I'll have to exit the PowerPoint and pull up a document at one point in the meeting, but we'll go with it.
Yep. We will keep our ears peeled. I'm going to go mute video and I'm going to mute
Me
audio,
too.
Charlotte, but we're here and we'll keep an eye on you.
Okay.
Yep.
Thank you.
It really takes a village, doesn't it?
Yeah. We have to have all these like security requirements and the live feed and everything. It's complicated.
Yeah. It's a production.
Mm-hmm. Yeah, we're working on, the same group has been helping me work on the webinar for the best practices.
Oh yeah.
In September, and that kind of has like, that's not a meeting, it's a different version of Zoom. So we're working on that one too. And that
You learn a lot about Zoom.
yeah, like at this point, I hope we don't ever switch from Zoom again because I don't know if I have it in me to learn a new one.
Yeah, and sometimes I'm on Teams, but I think Zoom is better. I like Zoom better.
It's funny because each agency uses different ones. Like the AG's office uses Teams. DBHDS uses, I think, WebEx. So everybody's kind of doing different things.
Yeah. I was thinking toward the end, if there's still questions about the priority of the recommendations or how many or something. I was thinking we could do a second rating toward the end if we wanted to hone it down a little further, because we would have had discussion and that might have changed some people's minds. So just something to keep in mind.
Yeah, okay. We can do that. I think everybody's going to be on today too. I don't think we'll have any absences. And I know, and David said he's going to join too, I think.
That's great. Did you find out if Beverly votes yet?
She can vote. Well, you know, we can ask, you know, if she could be I think she could be a tiebreaker.
Mm-hmm. Hopefully we won't need too many votes other than those up front and the one at the end.
Yeah. I'll probably have her vote and call her name just because that's in line with what we did last year, until we can get the bylaws clarified.
Yeah.
Hi, Joni.
I don't see her. Do you?
I see her listed. Joni, can you hear us? Carter, can you hear me?
Again, Charlotte.
Okay.
Cheryl, it's David. Joni has not connected via audio yet, so she may
Okay.
be either dialing in or working on that.
Oh, okay. Erica, did you see the chat there?
I did.
Okay.
Charlotte, if they want to, they can dial in by a phone, but if it works with the chat as they had indicated, that's fine too.
Okay. We'll keep an eye on it. Hi, everyone. We'll get started shortly. Erica, it looks like we're just missing Roland and Beverly at this moment.
Yeah. Should we give it another minute?
Yeah, I think so.
Good afternoon.
Hi, Jennifer.
Hi there. I mean, I apologize in advance. I still haven't quite got my internet. I think once my kids officially go off to college next week, I won't have internet problems. But until then, I don't have any video. It'll just be audio.
My cousins in rural part of the state said everybody's getting their internet upgraded these days. Looks like Beverly's joined.
Hi, Charlotte. This is Joni. I called in from my phone.
Okay, great.
I'll go ahead and mute myself now.
Okay, thank you, Johnny. Erica, and you have a quorum, and because I know time's tight. If you'd like, we can go ahead and get started.
So we're only missing Roland, is that correct?
Yeah, and I can do the introductory comments, the instructions if you'd like.
Yeah, why don't you do that? Why don't you go ahead and do what you need to do?
Okay. Good afternoon, everyone, and welcome to the Council on Aging Legislative Committee meeting. We have a lot to do today, and so I know we need to be diligent and conscious of the time. This is an electronic meeting due to the active state of emergency, and it's being conducted pursuant to item 4-0-0.01 of the 2020 Appropriation Act. Meeting notice has been provided. The meeting is being recorded and minutes are being taken. All votes will be conducted via roll call of voting members. The meeting materials were posted under the Council on Aging's quarterly meeting tab on the link here. Members of the public are able to live stream this meeting via the DARS YouTube page, but please be advised if the live stream is interrupted, we will have to pause the meeting until we can restore it. Public comment is accepted by email or phone with my attention. My information is listed there. And then public comments that were received by, I think that's the wrong date, clearly, didn't update that, by this meeting would be read, or if lengthy summarized for the meeting when we get to that agenda item. Members, please keep your microphones on mute unless you're speaking. This helps reduce background noise. Also, before you speak, please state your name. This will help your colleagues know who's talking, but it also helps with the minutes. I know we'll have a lot of discussion today, so that'll be a particularly important rule of thumb. If you have your video enabled, please be aware that the system may be capturing your image and video for the public streaming and for the recording of the webinar. You can use the chat feature as well. That's being monitored by my coworker, Elizabeth. You can also use reactions to do a thumbs up for agreement or clap to raise your hand. Also, that's being monitored. There are view options in the right-hand side of the Zoom that you can set yourself, with some features being set by the host. Again, for all votes, we'll do a roll call. And lastly, I would like to thank the DARS video teleconferencing team and the DARS communication team for helping make this meeting possible. We do not have captioning set up for this meeting today due to scheduling issues. So also please be advised to speak clearly into your microphone so everybody can hear you and understand you. Erica, at this time, if you'd like, I could do a roll call for quorum, or we could go through introductions and I could do the roll call that way.
Okay, let me just say a few words and then we can go through introductions. So I just wanted to welcome everybody to the meeting and say that obviously legislative items are at the top of our radar screen right now because the General Assembly is in special session, and so legislative issues are really coming to the forefront. And I think that the discussions that we're going to have today are really important and timely. So I want to thank all of you for being here and for participating and for contributing your issues. I particularly want to welcome David Broder, our new member, and just to say that I've known David for many years through the Northern Virginia Aging Network Legislative Committee, where he's provided tremendous leadership, and we're very lucky to have him. So special welcome to you, David. And so that with that, I think we can go ahead and introduce ourselves. And I'll start. My name is Erica Wood, and I've been serving as the chair of the Legislative Committee. I was appointed by the governor, and I'm beginning my second term. I live in Arlington in Congressional District 8. So Charlotte, do you want to call on the rest of the committee
Sure.
members?
David Broder.
I'm here. And did you want me to do a quick introduction?
I think so. It would help. Yeah.
Sure. So I'm David Broder. I'm new to the council as well as to the committee. And I really don't want to say anything more than that incredibly gracious and lovely introduction that Erica Wood gave me. I think if you get Erica to say nice things about you, you know you've made it. But I've been honored to work with her on the Northern Virginia Aging Network. I also am proud to serve as the president of SEIU Virginia 512. Our members are care workers and public service workers who serve older adults in many different roles across the Commonwealth as home care workers, as senior center staff, as Meals on Wheels staff, as nurses, public health nurses, mental health staff, on. And I have some of them behind me in my virtual background to always remind me to bring the voices of these wonderful workers into these conversations. And I'm honored to be here today. Oh, and I live in I live in Fairfax County in the 11th Congressional District.
Thank you. Jennifer DeSano. Oh, I think we might have lost her for a minute. We'll come back. Joni.
Hi, this is Joni Goldwasser. I represent the 6th Congressional District, and on my second term on the council. And welcome to David. Looking forward to having you on the council as well as the legislative committee. And I appreciate all the items on the agenda, Erica's work and Charlotte's work for today's meeting.
Thank you, Joni. Jennifer, would you like to introduce yourself? I think we lost you there for a second.
Yeah, thank you. That may happen again. Thank you for letting me back into the meeting, Charlotte. My name is Jennifer DeSano. I'm the executive director of the Osher Lifelong Learning Institute at George Mason University, and I'm a gubernatorial appointment here in District 10 in Fairfax County. And I've been serving, I guess, for a couple of years here on the council. And I think this is a great committee, and we do a lot of really good work, and Erica leads it so very well. And I'm looking forward to this meeting.
Thank you. Carter Harrison.
I'm Carter Harrison. I do the public policy work for the Alzheimer's Association here in Virginia. I also oversee our efforts in DC and Maryland. And I think this is my second term on the council, or yeah, I think I had a partial term before that. So at any rate.
Thank you. Erica, I think do you want to do yourself again, or?
No, I think I'm good. I think I said
Okay.
it.
Beverly Sobel.
Hold on, I have to.
We can see you this time.
You can see me. I pushed the right button. This is Beverly Sobel. I'm currently the chair of the Commonwealth Council, appointment by the secretary, not the secretary, by the Speaker of the House. and I serve as an ex officio member of this legislative committee and had served on the committee previously. And also I'd like to say I appreciate the leadership provided by Erica and Charlotte to make all this happen. Thank you.
Thank you. At this point, we're only missing Roland, but we'll keep an eye on if he joins, and then we'll let you know, Erica.
Okay, thanks everybody. So you should have received an agenda. And also, I guess it is going to be running on the screen, or we see the welcome in it. There it is. So the next item on the agenda is a review of the proposed agenda for today. And I'll just run through very quickly what that agenda is, just walk through it. We're going to begin by selecting and confirming a legislative committee chair. I've been serving as the chair, but we need to conduct an annual election for that. Then we're going to review and vote on the adoption of the committee minutes of November 13th, 2019. Then we have an opportunity for public comment, and then we'll get to the heart of our meeting, which will be a discussion of the 2021 policy platform. And we'll spend obviously most of our time on that. We will be adjourning at 4 o'clock or very shortly thereafter. And so it's important that we be concise and efficient while at the same time thoughtful and, giving due consideration to the full range of issues that are before us. So do I hear a motion? Is there a motion to approve the proposed agenda?
So move. This is Jennifer DeSanto.
Thanks,
Second.
Jennifer. Is
Carter.
there- Okay, thanks, Carter. Is there any discussion? Okay, hearing none, I'll ask Charlotte to conduct the roll call vote.
Thank you, Erica. David Broder,
Aye.
Jennifer DeSanto,
Aye.
Joni Goldwasser,
Aye.
Carter Harrison,
Aye.
Erica Wood,
Aye.
Beverly Sobel.
Aye.
The motion is unanimous.
Thank you. The agenda is approved. And now next we will select and confirm the committee chair for the upcoming year. Is there a nomination?
I'd like to move that Erica Wood serve as the chair of the legislative committee.
This is Jennifer. I second that motion.
Thank you. Thank you. I appreciate your nomination and I'm happy to serve. Is there discussion? Okay, hearing none, I will ask Charlotte to conduct the roll call vote.
David Broder,
An enthusiastic aye.
Jennifer DeSanto,
Aye.
Joni Goldwasser,
Aye.
Carter Harrison,
Aye.
Erica Wood,
Aye.
Beverly Sobel,
Aye.
and then it looks like Roland, I think you might have just joined.
Yes, I'm sorry I'm running late.
That's okay. I wanted to see if you wanted to register a vote for the election of Erica Wood as committee chair.
Yes, I'd vote yes.
Okay, and would you like to introduce yourself real quickly?
I'm sorry, I'm just getting settled and adjusting volume. Repeat that.
Well, 1 second. So that you passed unanimously, Erica,
Okay.
the election. And then Roland, do you want to introduce yourself?
I'm Roland Winston. I have a Senate appointment and I mainly do LGBTQ advocacy work. I'm sort of retired. I live in Eastern Rica.
Great. Okay, thanks everybody. So next on the agenda is a review and adoption of the minutes of the committee's November 13th meeting. Is there a motion to approve those minutes?
So move. This is Jennifer.
This is Joni. I'll second.
Thanks. Is there discussion? Okay, hearing none, I'll ask Charlotte to conduct the roll call vote.
David Broder,
Just want to ask, I was not on the committee at the time. Is it appropriate for me to vote on this?
you could abstain if you'd like.
I'll abstain.
Jennifer DeSanto,
Aye.
Joni Goldwasser,
Aye.
Carter Harrison,
Aye.
Roland Winston,
Aye.
Erica Wood,
Aye.
Beverly Sobel.
Aye.
The motion passes.
Okay, thank you, everybody. So moving on, now is our opportunity for public comment. Charlotte, do we have any public comment?
There's no public comment.
Okay, thanks for that. Okay, we've made it through those preliminaries. Thank you, everybody. Now we can get down to the heart of the matter, and that is our policy recommendations. So you should have before you two items. One is a summary of proposed recommendations for our consideration today. And the other one, that's the long document. And then there's a short one-pager by Charlotte, and that's a crosswalk of these same items in a chart form, which is very informative. And so I want to thank all of you who've contributed proposed recommendations. And if you look at the summary, you'll see that they fall into 6 categories. And that's why the list is so fat there. So we have 4 items that were submitted by council members. We have 4 items that were included in the letter that the council sent to the governor and the General Assembly that we approved at the full council meeting in August. We have 4 items that were included in the council's 2020 platform as shown in the 2019 annual report. We have 2 items that were carried over from the 2019 Legislative Committee consideration. We have 3 items from the Virginia Association of Area Agencies on Aging. And we have 6 items that I submitted for your consideration from the Northern Virginia Aging Network. So that is the universe of items that we're going to consider today. So as we stated previously, we won't be adding any items to this list, this universe. And our goal for today is to prioritize and select from that list. We need to hone it down because as we've discovered over the years with the council, and we used to have as many as some of you will recall, we used to have as many as 18 or 20 items. And that was difficult to focus and advocate on all of them. So hence it's important to prioritize. So if you look at the items, you'll see that there are 23 items, but that 5 of them came from different sources. So they're duplicates. So in actuality, there are only 18 items. So there, we've already honed it down somewhat. And you'll also see that the first item is different. The one that Charlotte's got marked NA up there is different from all the others, and it doesn't have a number. The reason for that is that it's an item that has to do with the council's authority and statutory duties itself, whereas the other 17 items have to do with services and the welfare and issues concerning older Virginians. So that's very different. So my thought, and I want to thank Charlotte too for helping me think through this process because it's complicated. But the thought is that we would take up that issue first and vote on that. And then we would use an informal prioritizing process to prioritize, just give an initial barometer through rating of the 17 just for discussion purposes. So that will be able to maximize our time on those items that most of us are interested in. So let's see. Are there any questions at this point?
Yeah, this is Jennifer. So I just maybe Charlotte can help me. I'm in the process of outside of the council working towards getting a Center for the Study of Aging started at George Mason University. And we've been in conversation with the Virginia Center on Aging. And so I'm just wondering if I should abstain from number 5 in any regard because of that connection, because any increased or restoration of funds to that entity would benefit this effort that I'm working towards, but I know that's the case in, you know, like for people, other people on this council are advocating for things on this document too. I'm just concerned. I wanted, Charlotte, your opinion on that.
Since this is an advisory board, that it's up to you what you feel comfortable with and your discretion. Since
Okay.
it's not a regulatory body or we're not deciding on any contract or procurement situations, I think it's just a matter of what you feel comfortable doing.
Okay, all right, thank you.
Okay, thanks. Okay, so then to proceed on, so let's look at that first item, which is called add report language to the council's duty. So let me explain a little bit what this is about. And we have discussed this before, but for David's benefit and to refresh our memory of it. So every year the council produces, as you've seen, the annual report with the policy platform. The report, though, is not automatically sent to members of the General Assembly because the code provisions describing the council's duties don't provide for that. They don't include the specific legislative language that would authorize the policy platform in the annual report to be sent to the General Assembly members. That's in contrast, as Carter knows, to the Alzheimer's Disease and Related Disorders Commission that does this, where the statutory duties do include that language, allowing the report to be sent to the General Assembly. So the council's duties, as you know, include a mandate to advise the governor and the General Assembly on aging issues and aging policy. So it's somewhat of an obstacle if our recommendations are not sent to them to proceed with our advocacy. So this proposed item, this would include the proposed language that you see if you're looking at the handout that we sent to you. It includes the proposed language which appears as it appears in the Alzheimer's statute and as it would appear in our council statute.
Erica, this is Carter. I think this is the most easily understood one and one that we've discussed before. So I would move that we, I guess the motion would be that we adopt this as a recommendation of some sort for it, because this language used to exist in this code section. It was removed, and I lose track of the years, somewhere around 12 or 13 in that time frame. So if it's appropriate, I'd go ahead and move that we make the change, or that we recommend supporting making the change, or whatever the appropriate language is. Charlotte, I'm sure you understand what I'm meaning.
Yes.
Is there a second?
I'll second. This is Jennifer.
I'll second, or Jennifer.
Is there discussion?
This is Roland. I don't know how many new people are on here, if it's just David or not. We talked in the past about we don't directly lobby, and so this report goes out as its own piece. But if any of us individually want to work on something, we can do that. For this specific item, is there an intention or a step that we're going to, as a council, try to find a patron for it?
So not well, the first step, of course, will be that the full council has to vote on it. And then if any one of us in our own roles wants to go and find a patron, then we could use, if it's passed by the full council, we could use this recommendation in support of that. That's my understanding.
Okay. So no change in this particular one to other issues.
No, this would simply authorize the report language,
Right.
which is a big step, a good step in the right direction, it seems to me.
Recommend I call the question.
Actually, I have a question, further discussion.
Yes.
Or do we have to act on his call to question?
It seems to me you can go ahead, Jennifer.
I withdraw.
Thank you, Roland. No, my only question is my understanding then is currently the the report is something that the legislators have to request to see, but this would be a push out to them. Is that basically what this is going to do?
Yes.
So that they'll receive it without having to ask for it.
Yes, every member will receive it. Yes, they'll receive it.
Okay, I think it's a good thing to do.
Yes. All right. All right. Hearing no further discussion, Charlotte, could you conduct a roll call vote?
Sure. So just to confirm, this is a motion to adopt the recommendation to add report language to the council's duties to the recommendations to be put forward to the council in September. David Broder,
Aye.
Jennifer DeSano,
Aye.
Joni Goldwasser,
Aye.
Carter Harrison,
Aye.
Roland Winston,
Aye.
Erica Wood,
Aye.
Beverly Sobel.
Aye.
Motion is unanimous.
Okay, thank you, everybody. I think this will be a really good, solid step forward, and could make a real difference. So we're on a roll here. So let's move on to the other 17 items. So as I explained, the idea now would be to try to informally prioritize these 17 so that we can maximize our discussion on those items of greatest interest to all of us. So Charlotte has put up a screen with the numbering of the items. So if each of you could select for your top 4 items, and we'll give you a moment to think about that. Charlotte will call on each of you and ask you for the numbers of those items. And then we should be able to quickly see kind of like a barometer of what all of us think are the most important. So this is not a vote. This is just an informal process. Questions about that?
This is Roland. I wanted to suggest maybe that we look at the 4 from 2019 first, and that there are a number on here that relate to funding, and with there being a budget shortfall, I guess it's simply COVID related, that we push the ones that are going to require funding to the bottom of our list. I'm not saying remove them, but I'm just thinking that they're the least likely to get any traction, because things aren't going to turn around and money for the state, in the next few months. The budget will be whatever it is after we come out of.
So why don't we continue? Yeah, go ahead.
Roland, I wonder if you think if people could, people might want to weigh things higher or lower based on that information. I think, I don't know. I mean, there might be some that people still want to be considered.
I think there are lots of considerations for each one of these. And obviously, the special session that has different considerations from the 2021 session. What we do today will need to be approved by the full council on September 16th. So, so we really need to be focused on that. But I think that each one of us has kind of a different calculation. And so I would urge that we just go forward and rate the issues and see where they fall, if that makes sense to you. But thank you for Roland. Roland, I think you've added an important perspective.
Erica, this is Jennifer. I can see really all of these are being very of value, of course. I think they all should be weighed equally. But I think for the purposes of, I wouldn't necessarily want to rank 4. Maybe I could give you 2 from, that I think, and then maybe we could, hone it down that way. Or we could go one by one.
Well, I think so. The idea was that each one of us you don't have to pick 4. You can pick 2 if you'd like, but that we could quickly see. So some of these items may not be of interest to any of us in this context, and they may then fall off the screen. So this is just a screening mechanism. And after discussion, we may want to do this again, because I think our discussion may change some of our minds. It may raise the issues up or down in our own estimation. So this doesn't need to be a one-time thing, but I just want to see if we can begin to get a rough estimate. Does that make sense?
Sure. Would you like I've got 3 I can tell you.
So I think Charlotte's going to go through and ask each of
Okay.
us for our 4, and then we'll be able to calculate that.
I can, Jennifer, we can start with you. I'll ask everybody to keep track of your numbers, because I'm not going to keep track of each person's. I'm just going to keep track of the aggregate numbering. Okay. Jennifer, would you like to tell me where you are?
Yeah, I would love to see the number 4. Number 5 is a personal one for me, and I really think would be benefit to the Commonwealth if we could get more sourcing for that. And these are both funding, so it's sort of opposite of what Roland was suggesting, but I really think those 2 would be very, very important. And then the number 10, caregivers. It's all funds, but
okay,
I think very, very important.
Would anybody like to go next?
This is Roland. I'm ready. 3, 9, 12, 16.
Okay. Somebody?
This is Joni. I like number 7, number 1, number 2, and number 9.
And Joni, you're able to see the same list that I have pulled
Yes,
up on your
I
phone?
do have the crosswalk out. So that's why I was going back and making sure I got the right numbers. I used the numbers on your list that's on the page.
Okay, all right.
Thank you.
Mm-hmm. Somebody want to go next?
Yeah.
I'll go if you want, Charlotte.
Thanks, Carter.
I have number 2 and number 10, and then I'm kind of, after that, I feel a little more indifferent. Not that I don't support them, but as far as priorities, that's probably where I would put them.
Okay.
Charlotte, I'll go next. This is David. I think with the caveat that every one of these items is important, I want to highlight 3 items, not number 3. Those are number 4, number 7, and number 16.
Okay. Beverly, would you like to go?
Yes, number 2. Whoops. Oh gosh, I don't know how to do that. 2 things at once. Okay, number 2, 4, 8, and 5.
And then Erica, I think you're the,
Yeah, I'm going to do number 1, number 4, number 13, and number 16.
did I miss anybody? Does anybody want to add one if they were under the 4 figure at this point?
I'll add number 16. This Jennifer. That was my 4th one.
Okay.
Charlotte, I think I got my numbers mixed up. I think I said number 10, but I actually meant number 9.
Okay.
Sorry.
Hearing no other ones, I'll turn it back over.
Sorry, Charlotte, this is David. I had one
I'm
extra
sorry.
one.
Yeah, what you missed? Which one?
Number 9 as well.
So yeah, that's 4 for you, right?
Yes, that makes it 4 for me.
Okay. All right, Erica, I think.
Okay, so is there some way that we could okay.
Me to tally them?
Top items that received four votes are restore the currently unallocated Medicaid adult dental benefit. And then secondly, require nursing home facility staff training on LGBT cultural competency issues.
Oh, sorry.
Those each received 4. And then the third one that received 4 was mandate sick leave for direct care workers in nursing homes and assisted living, as well as sick leave and benefits for home care workers. And then, so those, just in terms of our discussion, where we might want to focus our discussion, came out on top. And then, let's see, those with 3, so that kind of the second tier appears to be restoring the currently unallocated funds for the dementia-specific case management. That's the only one. Okay, so that would be sort of come in fourth there. And then there were a couple that received 2 votes, taking measures to help older adults address hunger and malnutrition during and beyond COVID-19, and provide full funding for the long-term care ombudsman program, very important during the COVID period. And then we had a scattering of other issues.
There was
with-
this, number 5 also had 2 votes.
Oh yeah. Restore currently unallocated funds for the Virginia Center on Aging, right? So that's kind of the third tier. And then we had a scattering of items that received only 1 vote. That was modify the Virginia Center on Aging statute. And then secondly, increase the Medicaid nursing facility personal needs allowance. Provide respite funding for family caregivers, designate agency on aging staff as essential personnel, and full-time infection preventionist and access to PPE in long-term care. So then we had several items that did not receive any votes. So it looks like there were 1, 2, 3, 4, 5 of those. So we've reduced ourselves to 12 issues, if I'm reading this right. Okay, so it looks like, Charlotte, that you have highlighted those top issues in yellow. And so I'm going to take them in that order and just ask for some discussion. So we're not going to vote on every single item right now. What we want to do is have some more informal discussion of each of the items and see if we can agree on 6 or so. It doesn't have to be 6, but approximately 6. See if we can get this down and then vote on a block. If we can't, we can't, but perhaps we can. Does that make sense? Questions about that?
Erica, when we go to full council, are you going to start with this whole list? Or are you just going to present what we have decided on?
I'm going to present what my thought was that I'd present what we decided on.
Sounds good. Thank you.
Yeah. I mean, that's the whole point, is to focus it and simplify it, prioritize it. So, so let's start with restoring the currently unallocated Medicaid adult dental benefits. And you should have a description of that in your list of issues.
Hey, Erica,
And-
Erica,
yeah.
I don't mean to interrupt, but David is the only new member of the committee, and this was one from last year. I would say if David has any questions, and my suspicion is he's pretty darn familiar with it, that we could probably assume that we all have a pretty good understanding of that item, and maybe we could save it some time for some ones that are perhaps require more discussion.
That's fine, but I appreciate the vote of confidence there, Carter. That's fine by me if it's fine by other committee members.
Yeah, and David's familiar with this particularly because it's been an NVAN issue for, it's been on the NVAN table. So that's great. So we're all in agreement with the very high importance of that. And I just wanted to point out how that relates to item number 1, and measures to address hunger and malnutrition, because without good dental care, you'll have many more problems in malnutrition of older people. So there's definitely a connection there. Okay, let's move then to item number 9, and that's required nursing home facility staff training on LGBT cultural competency issues. We had a great deal of discussion on this item during the past year, and the full council did pass it as part of the 2020 policy platform. We spent time looking at residents' rights and at staff training, requirements for staff training related to residents' rights, and requirements for staff training for nurse aides. And we also looked at materials that are readily available. And during some of that discussion was previous to the General Assembly, where the legislation was passed, really addressing discrimination against LGBT individuals. And so things are in an even different light than they were. And it seems like would fit in with that legislation. Any comments about that?
Erica, this is Joni. I just want to add the point that during our discussion, we did say that there was some training for licensed staff, but there's a lot of workers in these settings who aren't licensed, and that we wanted to sort of encompass the not only awareness but competency training for that facility staff was a bigger, catch group.
Yes. Would you change the wording on that, or is it?
No, I think the wording kind of, even though it's generalized, it includes that because the licensed people are going to get it anyway. And it might happen more often, like it may vary per facility if it's just on orientation or an annual competency, per professional group.
Well, that's a good point, Joni, and that's something that we can emphasize in the little description that we'll write for the policy platform.
Great, thank you.
Erica, I was just sort of reviewing, I think Roland's statement from last year referenced the cultural competency in a broad set of terms. So it would, I think, cover all the pieces that Joni is talking about, unless I'm misreading it. And I think if I remember Roland's comments correctly, and Roland, you can correct me if I'm wrong, but you were sort of basing this off of something that happened in DC for cultural competency. Am I remembering that correctly?
I'm not remembering what you're talking about as in basing it on. The example I gave was people that are delivering meals or cleaning the rooms, processing to a person that lives in a long-term care facility. And I had a hesitation. Erica thought I might be changing this, and I wasn't sure last week. 581, I think it's a House bill, was passed that requires, let me look at it a second so I can read this one sentence correctly. Department of Human Resources Management is required online training for diversity and cultural competency. And this is for state employees. And I was trying to think whether or not it made sense to say that training was the one that needed to be done. But I think that we don't need to get specific on anything like that. I like the wording as we have it now, because the legislation, if I have a sponsor, and I'm sure I will be whatever the patron wants to do. So I think as we have it worded now is perfect.
Okay.
This is Beverly. I would like to just ask a question. I see that, and we have discussed this many times, about requiring nursing facility staff training. But we have an awful lot of people now who reside in assisted living. Are we determined to limit this to nursing facilities? Because we have a preponderance of people in assisted living now.
Beverly, that's a good question. I think that I think that our thoughts were, because assisted living is regulated in a different part of the code with different provisions, that it's not any less important, but that we wanted to focus on this as a first step. But I certainly see your point that assisted living is, those workers are just as critical to get cultural competency training.
I
I'm
think also
certainly
what,
happy to add that.
yeah, I think because what Beverly is also maybe not saying, but that there's a lot of times staff can transition from a nursing facility or an ALF and back and forth. And so we generally try to keep some of those requirements as similar as possible. So to make that transition easier, they're not all the same, but I mean, I think adding ALFs would be appropriate, and you could draft the bill in such a manner that it does that without being a problem.
If I might say, I would totally support that.
That sounds like a very sensible extension to me. I mean, last year we felt more limited than we are now. And I think that we could easily add the assisted living and would be a benefit. And again, we're not voting on this now, but is there anybody that opposes that addition? Okay. All right. Well, given that there's no opposition and given that all the points that you've made, Carter, and that you've made, Beverly, and that you've made, Roland, I think we could certainly extend that, broaden that piece. Okay. We're moving on with all due speed. All right, so let's go down to number 16, mandate sick leave for direct care workers in nursing homes and assisted living. So there we have both. And not only do we have nursing homes and assisted living, but we have home care workers. And obviously with COVID, this is an item that's really on the front burner. And you know, I might ask David to say a word about that, because I know that he's been working on this item for many years. And I also know that there's a sick leave bill that's going to be introduced by Barbara Favola on the Senate side and Delegate Guzman on the House side. Yeah.
Just to let you know, Erica, that Senate bill has already died in committee.
Oh, it's already died?
Yeah, David probably knows more about it than I do, but.
Okay, David, tell us what's going on.
Being mindful that this is being broadcast and recorded, I'll use my best poker face. Yeah, so Carter is right. So yesterday, the Senator Favola's paid sick days bill died in the Senate Commerce and Labor Committee. I think House leaders were very quick to say that it is still their intention to pass this bill. And folks talked about obviously the need for it. I don't think I need to convince anyone here that we need to make sure that direct care workers, whether they're in facilities or whether they're in home and community-based settings, need sick days. That absent that, the choice between whether to go to work or put food on the table is a terrible choice, and that when workers who are working hands-on, who cannot socially distance with older adults, particularly in a pandemic, don't have the ability to quarantine, this is a public health crisis for all of us. And I think this is going to be an ongoing issue, it sounds like, and will still be on the table come January in one form or another. And full disclosure is an issue that I work on, but strikes me as a top need for the Commonwealth.
Thanks, David.
Erica,
Yes.
looking at this in more depth now, I think maybe David has an opinion on this, but we might want to say home care workers, including personal care, so that I don't know if that's, because sometimes home care is like the more home health side, and then I don't know, at least from my Medicaid background, personal care is something else.
I think what we're focused on here is direct care workers, whether they be in nursing homes, assisted living, or home care. We're talking about the people that actually give the care. And yes, we're not talking about home health necessarily, but nurses' aides and personal care attendants and similar positions. And so we could make sure that we put in those words, direct care workers.
This is Joni. I agree with how Charlotte used the words including personal care, because many times those other positions are paid positions with benefits, may or may not, but the opportunity is there for benefits or policies to affect sick leave. So adding including personal care workers, I think would clarify our goal.
Okay. Other comments on that? I mean, that's such a huge topic that I think it would well behoove us to have that on our list, because and to have the General Assembly members know that this is an item that's important to the council. Okay. Other comments on that? You all are so agreeable. Moving on. I will move on unless you tell me not to. So we've covered those 3 key priority areas. So let's move on to the green. There was only one item that received 3 votes, and that was to restore the currently unallocated funds for dementia-specific case management. Carter, did you want to comment on that?
Sure. So for years, the Alzheimer's community has been working on case management, dementia-specific case management for its population. We have done it through a series of ACL grants and collected data, and lo and behold, we got the Assembly to start a pilot for us during this last session, and then COVID comes in and punches me in the gut, and we lose the funding to that. So I feel like this issue is ripe for moving forward. The appropriation is relatively small, but it has a pretty big impact on people with dementia's lives. There's a lot of data behind this, and I know from a Medicare perspective, there's a lot of consideration related to alternative payment methods around getting dementia-specific case management in place. I think this puts Virginia in a position to be a leader in this area, and so I would hope that we would be able to move forward with this, especially when the amount of cost is relatively small and the impact is fairly large.
Thank you. And those of you who were at the August council meeting will recall that this was one of the 4 items in the letter that we did send to the General Assembly. So this has been passed and approved by the full council, but we want to come back here in the 2021 platform and indicate that this is still something that's important to us.
Erica, you might also, I would just note too that, and Carter, who serves on the Alzheimer's Commission or works closely with them, I guess, that this is something that your sister advisory board, the Alzheimer's Commission, has also been supporting.
Absolutely, absolutely, yeah. Okay. Again, I want to make sure that everybody has a chance to comment and that we're not rushing on too fast. But so please intervene if you think we're going too fast. Okay, so that's the one green item with 3 votes. So let's look at those that come next. And I want to talk a little bit about item number 1. Take measures to help older adults address hunger and malnutrition during and beyond COVID-19. So I submitted that, and also V4A submitted that. And also we had discussion of that at our legislative committee meeting last year, although in a narrower form. We were focused at that time on use of waiver funds for liquid nutritional supplements. But this is much broader. And so the reason that I've been thinking about, and this is, you'll think this is very broad, and it is, but if you look at the council's duties, there is language in section 51.5-128 that direct the council to work on strategies to improve nutritional health, alleviate hunger, and prevent malnutrition among older adults. So we've never really focused specifically on that. And COVID has exposed its importance. The area agencies on aging have really jumped forward in a wonderful way to address hunger and malnutrition. And they've all been providing not only home delivered meals, but they've found ways to provide meals to those who previously were coming to congregate centers and senior centers and beyond that. And in fact, if you look at the best practice awards, the council's best practice awards, the #1 award was in the delivery of groceries to older adults. So the history of this item is that when Bob Blancato was on the commission, he worked with Senator Favola in a different role. He had a different role, and that was advocacy nationally for defeating malnutrition of older adults. And there was a bill introduced and passed to get this language into the code. So I'd really like to see the council take this up, and keep in mind that this is a policy platform. It's not just a legislative platform. There are other ways that we could take this up, but I think that the spotlight that's COVID's thrown on this and the spotlight that we have in the code really argues for our giving it more attention than we have. So, and as I said, it relates to the dental.
This is Roland. Erica, do you have an example of another way we could take it up other than legislative? What are you talking about with that?
Sure. We could appoint a subcommittee. The chair could appoint an ad hoc committee of the council. They could seek funding. They could look in, do some background research, look into what other states have done, because there's a whole website on this, and with many details on what's going on in other states. And it would take some study, but we could have a task force that reports back to us on a strategy. We could seek funding, which is in our power to do, and really move ahead on this.
Erica, this is Joni, and I just wanted to provide some input based on, in November, when we talked about this, I was going to go back to my AAA and talk to them and find some information on the process. And I've done that. And there was an array of discussion between the nutrition folks, the registered dietitian, and even the director of the local AAA. And one of that was, of course, the original item was supporting inclusion of nutritional supplements, which is no longer supported. But there was a big push for people to remember that the older adults being served by these programs, many are physically unable to prepare meals. They have many physical limitations. If they're relying on family's not always available due to work. The other information is, remember, there's different programs. There's Meals on Wheels for Homebound. There's income-based that not every agency has funding for, like the Senior Food Box program is supported here in our area in Southwest Virginia, but not in all areas. There's no funding for fresh produce or foods. And the DARS requires a registered dietitian, which is costly, and there is very minimal pay, but it's because counseling is required, and sometimes there's issues regarding counseling versus a meal when push comes to shove in the AAAs. Again, like in the Southwest Virginia, we have an emergency food pantry, but not all AAAs do. It depends on grants and priority setting in their area. The CARES Act is soon to be gone. That's only temporary, and many received extra funding, during COVID because of that. So there's lots of issues that go into nutrition that I just think people, and it might go back to your information and Roland's discussion about this is such an important area in terms of nutrition and supporting, you know, dental benefits. But I think the scope and breadth of it is pretty big. I don't know if anybody wants to add anything.
Yeah, I also wanted to say that when I looked at the website, it's called Defeat Malnutrition Today, and it's about defeating malnutrition in older adults. And one of the things that was emphasized is to try to get a recognition of malnutrition as a key indicator and a vital sign of older adult health, because I guess that it's not included often in looking at the indicators, and that it should be, in other words, it should rise higher on the radar screen when there's an assessment. So that's just another way to look at it.
Eric,
Oh,
I'm sorry, go ahead.
oh, this is Jennifer. I think, you know, there are many layers to this, socioeconomically, and just depending on geographically. So we know that there are food deserts where, like, cities may have just fast food options, or, you know, and some people might not have even a stove in their home. They might be operating off of a microwave. But so there's, and then if you're in a really rural area, you might not have, you know, ready access or the ability to get to, you know, resupply whatever to get food. So the food delivery system is also something to consider, you know, and those connections and things. There's a lot of study that should be done on this.
Erica, I'm curious. This sort of feels like what happened when we needed to rewrite the code sections on aging to sort of clean up the mess. I mean, we really needed somebody that could get into the issue and look at it closer. I wonder if this isn't the type of issue that would lend itself to having the chair of the big committee appoint a smaller group that would allow them to gain some expertise and make some really meaningful recommendations moving forward, as opposed to sort of us just putting something general into the platform item. I think, I mean, from where I'm sitting, and I serve on the most rural AAA in Virginia, and probably the poorest. I'm not sure if we are the absolute poorest, but I think we're the second most as far as the region is concerned. And the biggest issue for us has been the ability to be flexible with the funding that we received through the Older Americans Act. And you know, if we wanted to buy groceries, we could do that. If we need to buy fresh vegetables, we could do that. We can move money from the congregate setting to the home delivered setting. That's been the biggest win for us. But I feel like this issue lends itself to having somebody, a smaller group of us, get some real expertise in it and make some meaningful and thoughtful recommendations. So I'd hope we might consider that for this group, for this issue.
Erica, this is Beverly and everybody else. I'm listening to this discussion, and I'm in total support of us moving toward this direction, And the idea, the concept of establishing a task force and going beyond this small group, and even exploring the potential for people who are experts in this to come work with us. This is a vital interest, or should be, to all of us. And I would endorse us zeroing in on this. When you say the chair, are you referring to me?
I am.
Okay, and I would accept that as a real challenge. And I think we have a group here today who are working through this. As one of you said, it's multi-leveled. It is multi in every sense of the word. So I would endorse this.
Thank you so much, Beverly. You know, I think that it's interesting how things work, and having this on the list has prompted this discussion, which has prompted you to say, Beverly, that you would welcome that challenge in appointing such a task force. So given that, I mean, we could always do both. We could leave it here, but in interest of honing down this list, if we know that we're going to come back and really dig deep really dig deep into this issue, and then we could come back legislatively next year if need be.
Erica?
Yeah.
This is Jennifer. This might also be, in addition to those suggestions and doing an ad hoc and so forth, it might also, as a topic, be a good thing to fold into the next number 5, which is, VCA's work. It might be something we can put in addition to things we'd like to see explored and worked on more, as if we were to move forward on that initiative, number 5.
Jennifer, that's a great idea. And again, it's interesting to see how all of these pieces relate as part of a bigger puzzle. But I think this has been a tremendous discussion, and one that I personally have wanted to have on this council for a long time. And I'm happy that it's risen to, even though not the top of our chart, it's still risen to a point where we can get something done about it. So thank you all. So I would propose, just informally, because we're not voting right now, taking this one off right now with the caveat that we know that our chair is interested in moving forward on it and appointing a group to look at that. And if there's no opposition to that, let's take that one off for right now. Okay. All right. So given that, Jennifer was just mentioning number 5. Well, she was mentioning the Virginia Center on Aging. There's actually 2 items that focus on the Virginia Center on Aging, but number 5 focuses on its funding and restoring the unallotted funds. So the Virginia Center on Aging gives a whole number of small grants for geriatric and gerontological training, and is key in the development of those skills throughout the state. There were funds allocated, 100,000 in each year of the biennium, and then those funds were unallotted. So comments on that?
Who brought this one forward?
That was in our letter. So this has been passed by the full council. It was one of the 4 items in the letter that we sent to the General Assembly.
Erica, when I hadn't looked at this item very closely, but when I did, I was unable to tell specifically what it went to at the Center on Aging. I'm not saying that I have an objection. I know, for example, they get funds for doing the R draft, for example. I know they have gotten funds in the past for doing the geriatric training initiative. And I also know that as a result of them being at VCU, there's some overhead that they pay to VCU for that relationship. So the only thing I would ask is, I'm curious where those funds were earmarked for, or were they earmarked, or they just general dollars coming in. I wasn't sure, but from reading the language.
So I'm actually a brand new member on the Virginia Center on Aging board, so I'm not fully qualified to answer that, but I do know that they have a number of different streams whereby they give a series of small grants. And I do know that in whichever program this is talking about, they were getting up to twice as many well-qualified applications for programs that really deserve to be funded, but had to turn them away, and that their funding for that stream has decreased over time. So I can tell you that.
But you don't know which stream that is. I'm just curious.
I'm trying to rack my brain, and there's so many initials in that, and I'm getting them a little confused, but I don't know, and we can look at that. But it is a specific stream. It's not just give money to the center.
That's fine. The only reason I ask is there hasn't been a lowering of their appropriation in the state budget at any point in time. So that's why I was asking. So this must be some dollar amount that is outside of the state budget that they have been losing. In other words, are they backfilling a grant? That's
I think I might be able to. Sorry, I think I might be able to help with this. I think they have struggled particularly, with everything going on, with the, it's not Elder Road Scholar Program, which has basically had to be suspended because of the pandemic, but that was one way that they were able to supplement the work that they did.
We can clarify that. If need be, we can certainly clarify that with the center, if that turns out to be one of the items that we want to move forward.
So just looking at the topic line that you have in the summary page, it looks like it's training initiatives. So, I mean, it would be great to get clarity on that, but if we can support the work of the center, I think it's going to be a good thing, and probably align very well with what we would like to see happen in terms of research or training opportunities throughout the Commonwealth for the practical application of what people need in supporting our aging community. So I mean, I think it's always a good thing to support the center. And as I said earlier, if you look at the summary, it says that the center supports training initiatives focused on dementia, advanced care, medical planning, caregiving, mental health, and other best care practices, but current capacity falls short of the needs. So although that's sort of contradictory to what you just said about the funding stream not having been cut, Carter, I'm not sure. I haven't really looked. I don't know what they're saying. What's being said here is that the current capacity falls short. So either there's more demand, and I guess that's what you were saying, Erica, that there's more demand for people seeking funding to do different things, and they can't satisfy it because they don't have enough money to do that. And if that's all good work and moving towards the goals of the council, I think it's always good to try and support educational institutions that are training up our workers and our researchers so that it can improve best practices.
This is Beverly. I think that the money that is short at this point has to do with the VGEC, the Geriatric Education and Training Grants. Isn't that correct, Charlotte?
That's what, in my conversation with Bert Waters, that was what was relayed to me. Yeah.
Yes, I think that's what it is. And
then the Geriatric Training and Education Program, GTE, falls under the umbrella of the Geriatric Workforce Education Center. Or what program?
Yeah. And it's definitely been of tremendous help and assistance to those people who apply for the grants and who produce the training. Right now, I guess everybody will have to be doing virtually, but there has been a great deal of support for that in the past. So I think we should look into it. And I think one of the items that we're going to have a discussion for, Charlotte, if I'm not mistaken, is to have the Center on Aging come and talk to us about what they do at the center. And that would definitely come within that.
Yeah, it seems clear that all of us are interested in the center and what the center does, but we do need some clarification. But I think that it sounds like we're agreed that geriatric and gerontological training throughout the Commonwealth is something that we really do want to support if we can.
Erica?
Yeah.
I don't know if you're moving on to number 7, but I wanted to be conscious because Joni does have to leave at 3:30. So I don't know if we're at the place where we would vote, but I thought we might want to give her, even right before she has to leave, an opportunity to voice kind of where she is after hearing the conversation so far.
Sure. Joni?
Oh, I think what Charla was saying, I had just sent her a message that I have a meeting that has just come up. I'm at work and I need to go to at 3:30. And I just wanted to let her know. She said there will still be a quorum and that perhaps I could give my opinion. It might not be a vote or just any final poll from myself. That's all. And I'm actually very interested in moving on to number 7 on the long-term care program.
Okay, well, let's go there then. Let's move on to number 7. And certainly in times of COVID, with all of the deaths and the cases in nursing homes and assisted living, and the Ombudsman program also has a role in home and community-based care as well. And that's been, and of course, the Ombudsman during COVID could not go into the facilities, but has still been playing a tremendous role and is obviously a key piece of the puzzle in providing that much needed care and response during COVID. And for many, many years, the Ombudsman has been has not had the full funding that it really requires. And we've discussed this in the past many times, that the recommended ratio is 1 to 2,000 beds, 1 full-time ombudsman to every 2,000 beds. And in most parts of the Commonwealth, we fall far short of that. And not only is that recommended as a national standard, but it's actually mandated in the Virginia Code. But then it says, comma, if funds are available, and full funding has never been available. So this would advocate for that funding for that much needed program.
Erica, this is Joni. I know in our area, we look at this pretty seriously and that we're not in compliance. We should have 2 full-time positions. We have 1, maybe kind of 1.5. So it's like, not only, as you said, a federal mandate with that caveat, if there are the funds. So, you know, it's an area that I would support going forward on our list too.
And this item was passed by the full council it was one of the 4 items that we passed in the 2020 platform. And it was passed, I think, with no opposition. The council was very supportive of that. And you'll recall too that we heard from Joni Latimer, the director of the State Long-Term Care Ombudsman Program, at our August meeting. And you got a little taste of all the things that the Ombudsman Program faces. Okay, I'll move on because we've in the past had a great deal of discussion about that, and I think we all understand and support that program. Okay, so all right, so we've got, so Charlotte, how many items do we have at this moment? We've got 1, 2, 3, 4, 5, 6. If where we that have more than one vote, we can still go on and discuss more.
You have 7 plus the one that was already adopted.
We have 7 plus the 1, so we have a total of 8.
Correct.
Okay.
Charlotte, this is Roland. Would you amend the vote tally? The one for number 3 is mine. Will you take that off? And the one for number 12 is mine, if you'll take that off.
I'm sorry, could you repeat that?
Yes, I'm asking you to amend the vote tally. The 1 vote for number 3 is mine, if you would remove that. And the 1 vote for number 12 is mine, if you'd remove that.
Did you want to put those somewhere else, Roland? Well,
I think that's a good, I mean, we could, at this point, Eric, if you wanted to see, based on the discussion of the ones so far, if anybody wanted to move a vote around, we could do that as another sort of poll. You know, we're at it's 3:20 right now.
I mean, essentially, we could almost re-poll, is what you're suggesting.
Yeah, I mean, we could do a clean slate too, and
yeah, we can do the poll all over again, taking off the ones that have no votes at all.
yeah, I could. Okay, let me.
I suggest that we do 2 votes instead of 4.
Okay. All right, let's just pause for a second to give everybody a chance to think.
Would it be easier to just delete these rows or?
Yeah, I think just delete the row, and you can delete number 1 because we're going to take a different strategy with that.
Well, I might move that one down so we can see them all in totality at the end.
I'd like to know why Carter's recommending 2 instead of 4.
Oh, just because I figure I just picked a number on the top of my head because it would just be more priorities. I mean, but it doesn't. I'm not wed to it, but that was why I suggested it.
Didn't we ended up with 4 for 2019 report?
Okay, well, 4. I mean, then I don't object to 4.
You have 5. Well, you had 4 from the legislative committee and 1 from the special subcommittee on the aging code sections.
Are we not going to move number 1? This is Joni to a task force.
Yeah,
Oh.
we're going to move that, but yeah,
So take that one off.
take that one off for now, for this vote. So we have 1, 2, 3, 4, 5. We actually have 6 items, which is really in the ballpark here. But so why don't we each? Yeah, why don't we? Did we decide that we would each name two of them? Is that what we're doing?
That was Carter's recommendation. I don't see any problem with us having a list of 6.
This is Joni, and I support what Roland's saying. All those 6 listed there are extremely important to me and to our area.
I don't object to 6.
Yeah.
This is Jennifer. I think all 6 are great.
And just to clarify, you'll have 7 total.
Yeah.
Correct.
That's
I
fine.
think
It's a
that's-
miracle for us.
Yeah, I think that's within shouting distance. I think that's just fine. So given that, and given that time is passing, do we want to call for a vote on these?
Madam Chair, I move that we adopt these items as
Wait.
no, I'm sorry. I was trying to move us
Wait,
along.
we never really came back to that. So are we on to long-term care facilities in general for this one, or nursing facilities and ALFs?
Oh, I think that since no one opposed adding assisted living, and since everyone seemed positive that we would add that.
I was going to ask after the discussion about 16, whether or not it's appropriate to also add personal care. I think you're in,
Yes.
adding personal care workers to the number 9.
Yeah, that one, I think just for the interest of like how this displays in a report, we might have to finesse that language there a little bit because it's a little wordy.
Yeah, I think so too, because I think personal care workers are the workers that we're looking at in that. So it's not just that we want to include them. That is the population that we're looking at. So we might.
So you're saying we will make 16 and 9 mirror on the who it includes.
I'm sorry, I can't hear you very well, Roland. I'm saying that 9 is now including nursing homes and assisted living facilities based on the discussion. And 16, the title of that one and the phrasing needs to just be cleaned up a little bit so it's more consolidated, but we're referring to direct care workers.
Yeah.
Paraprofessionals, basically.
That's the key is, I think, direct care workers in any of those settings, be it at home, in a nursing home, or in assisted living. We're looking at direct care workers.
And
Does that
so I was
answer-
simply asking if we can make that language be mirrored in number 9.
Oh,
You want direct care workers in here?
Yes.
only direct care workers?
Well, I'm asking for the mirror to number 16. Whatever you decide on 16, I'm just asking about mirroring it in number 9. Unless
Okay, I think
someone's
that might be different. I think, Roland, that might be not exactly what you are intending because a direct care worker is not necessarily a janitorial staff, a kitchen staff, the direct care workers are usually providing personal care service, helping with eating, bathing, dressing, transferring.
Hey, Charlotte, I think I understand what Roland's saying. He wants you to include personal care workers as a category. So you have nursing home, people that work in nursing homes, you have people that work in assisted living facilities, and then you have personal
home health
care.
care.
Yeah, personal care aides or home health aides or.
Okay, well,
Am I understanding you correct, Roland?
Yes, and home health care essentially. Then I got confused when you were shifting the language on direct care and home health care. So whichever you all think is appropriate, I'm fine with.
So did you want to add and instead of or? I think and home care workers. Yeah.
Yes, thank you.
I guess facility staff would be modifying. It would be moved up. Yeah.
And I would make a motion that we recommend these 7 items to the full council.
Is there a
I
second?
think there was already a motion on the floor, wasn't there, from Carter?
Okay.
Yes.
I'm
you're
sorry,
right.
Carter
I
withdrew it
second.
because they were amending it. So now that they're done, I'll renew my motion to adopt the amended.
And I second.
Thank you.
Any more discussion? All right, hearing.
This is David. Also, this is an extraordinary list. I'm proud to support it. The one thing I would want to note, I'm not sure how it works here, I'm strongly in support of number 9, that requiring that kind of cultural competency training for consumer-directed home care workers, I think would be a different approach to training for consumer-directed home care workers than has been taken before, and that there should be some work or outreach with the disability rights community.
Yeah. I would kind of second David's thoughts just as staff to give you, I think that that's a, you know, the long-term care facility world is one world, and then the home care, personal care, consumer directed is another. And that's going to require a whole other conversation with different organizations. And I would just be cautious that you maybe not think about if this has become too big of a recommendation to actually accomplish.
Well, I wouldn't have gone there if I hadn't been reading number 16, but I'll tell you why I think it is important in some form. And it's probably a year ago now, I had a conversation with Dean Longo after one of our meetings, and he has a home healthcare business. And he was concerned about how he was supposed to handle a trans employee and sending them into the home. And so my point here is that those businesses, maybe not individual nurses, but those businesses need to understand LGBT.
Well, you could, Charlotte, another way you could do it is you could have, I mean, I don't want to get into the weeds here, but you could have the agency directed have one set, and then you could perhaps target the facilitators, the service facilitators for consumer directed. That may be another way to sort of parse that. I don't know how David feels about that, but he's right. I mean, obviously the disability community is going to have some thoughts about this no matter what, but that I think that may accomplish your same goal, Roland, but I'm open to being wrong.
I think
Yeah,
that's
thank you,
right.
David.
Oh, I'm sorry, Roland, go ahead.
I just said thank you.
I think that's right, and I don't want to certainly don't want to micromanage. I think as staff put this work together, and I think it's an important conversation to have with the disability rights community as well, the intersection of consumer-directed care and training and equity and inclusion. So I'm appreciative of this council taking this issue on.
And what do we mean by Medicaid agency?
Well, the modifier is agency directed, and that's when in Medicaid, David, unless you want to explain this, whichever.
I'm happy to have you do it, Charlotte.
Okay.
And
So-
let me know if I can be helpful. But
Okay, so individuals who receive personal care and Medicaid under the waiver services can receive it in 2 different ways. One is agency directed, meaning they go through an agency and the agency has an employee that's the aide and they send the aide into the home. The other is consumer directed, and that's when the beneficiary hires somebody they know to be their in-home personal care aide.
I guess my question was, is Medicaid the descriptor for the agency directed personal care, or is it agencies that provide Medicare services?
Well, agency directed appears in the Medicaid program. What this is I mean, we can finesse the wording, but what this is Medicaid long-term services and supports agency-directed personal care.
Okay.
So this
Thank you.
is separate. So what about home care? You were talking about Dean Longo and home care agencies that
Yeah,
are.
yes, that's why I'm trying to understand exactly what the breadth of this is, because home health is a different, and kind of different animal as well. And that could be paid for by Medicaid, Medicare, or private insurance, or private pay.
So the question is, did we want to include that group, that as well? So how broad do we want to go?
Or is this something that maybe needs further discussion or reflection, you know, in another, I don't know. Up to you. You have time,
I think
3:30.
we need to spend a little more effort to qualify exactly what we mean with this, so everything doesn't get lost with the intent of having the cultural competency for LGBT training. That's my concern.
Well, let's simplify it so we can finalize it and go back to the ALF and nursing homes.
Okay.
Well, what if we just said in home and community-based care? Because I mean, that's got so many different pots and so many different iterations, but I'm not sure that we need to specify them all in here.
I guess the thing is if somebody was going to be not translating this necessarily into a bill, but if there was a bill that was supposed to be aligned with the initiative of the council, in order to have a bill, you would have to be able to be clear about who you're, you know, applying the training requirement to. Like you couldn't just
Correct.
do home and community-based as a concept.
Right.
Correct. This is a recommendation, not the language for legislation. And I'll probably work with Sage to try to get the right language. So I appreciate David clarifying and reining us in here. I like the way it reads now. If you want to take out and home and community-based care, even, that's okay. I like it like it is, though.
So is everyone comfortable with moving it forward like it is? I just want to make sure I'm understanding correctly. And if that's the case, I'd like to renew my motion.
Yeah.
Happy to second that motion.
All right. Is there further discussion? Okay, hearing none. Last chance, I'll ask Charlotte to conduct a roll call vote.
So this is to put forward the recommendations listed in the top table to the council for the September 16th meeting. And these recommendations will be slightly cleaned up and modified by Erica and I and presented at that council meeting along with the annual report. David Broder,
Aye.
Jennifer DeSano,
Aye.
Joni, I think we lost Joni, right? Okay. Carter Harrison,
Aye.
Roland Winston,
Aye.
Erica Wood,
Aye.
Beverly Sobel.
Aye.
The motion passes.
Yay. All right, we did it. And it's only a little bit after 3:30.
Oh, Erica, I want to thank you and Charlotte for all your hard work on this. This is tremendous work. Thank you.
Thank you.
Absolutely. I appreciate it.
I want to thank Charlotte because she really helped me think through this process, and I think it worked pretty well. And I think that the items that we've selected are all just top notch and very important. So thank you all for your contributions, and we're going to look forward to having this before the full council on September 16th. So I think that we've conducted all our business and gone through our agenda, and unless anybody has anything else, the meeting could be adjourned. Any final?
I make a motion to adjourn the meeting. This is Jennifer.
Okay. Do we need a motion, Charlotte, or
I
can we?
think you can just adjourn it.
Okay. All right. Well, then, as chair of this committee, I'll go ahead and adjourn the meeting and thank you all.
Thank you.
Thank you, everyone.
Thank you all.
Thank you.
Okay, are you guys, we're good? I can't hear you, Elizabeth.
I got the
Uh,
recording.
You can end the stream if you'd like, if you want to stay on the live stream.
I have to, let's see, I end the stream, sorry.